to Just in Time. Are you terrified at takeoff? Do you grit your teeth when you hit some turbulence? Do you really fear for your life when you come in for a landing? If just boarding a plane makes you want to head for the hills, you're not alone. Lots of people have a fear of flying. But here to give some advice on how you can overcome it is clinical psychologist Martin Seif. Martin.
A job promotion, that's when phobias start to come. And very often when people get job promotions where they have to travel for they have to fly for their job, that's when the phobias start to emerge.
As we went into the break, I was telling you that my young daughter, who is in college, has flown since she was 6 weeks old.
Very common.
Loved flying, never had a fear, and then about the age of 15,
Well, the median age for it to start is somewhere between the age of 15 to 25.
She's right on target, huh?
During period of transition or change in a person's life.
When a person has this kind of fear of flying, what's the worst thing that people can say to them?
The worst thing?
Like,
it's all
get
in your
over
head.
it?
Just go ahead and do it, because people are really afraid of panicking on the plane. That's what they're afraid of. They know in their mind that it's safer to fly from, say, New York to California than to drive from New York to California. I hope I said that right. Okay. But what happens is that even that knowledge in their head doesn't take away the terror that they feel when they get on the plane, because they're terrified they're going to panic on the plane, and for them it means losing control, doing something that's embarrassing, having a heart attack, having a stroke, losing their mind, going crazy, or even dying. And that's what they're afraid of.
So we know that if we want to be supportive, whether it's a family member or a colleague, that we first of all don't just say to a person, get over your phobia, because phobias are real.
The fear is automatic. The fear comes. What you want to try to do is help them say, once the fear comes, how can you best manage it?
All right, how can you?
Well, there are lots of, part of the way that we work is based on the model that we're talking about. But if we just have a minute or two, here's what I'd say. Number one, the fear comes automatically. There are lots of paradoxes involved in the treatment of anxiety. One of them is the harder you fight the fear, the greater it becomes. If you think of fear as a form of tension, if you fight that tension, you're just adding more tension to tension. So really what you'd like to do, and it's the easiest thing to say, the hardest thing to do, is to do nothing. When fear comes, just let it be. Because once you learn about fear, once you're educated about fear and about panic, you realize that panic comes, and if you do nothing, it goes away quickly.
Somewhat like pain, that if you don't grab and get tight like this, but if you relax.
But it's completely counterintuitive, because a person feels that they're fighting for their life. They're holding on to the, these are white-knuckle flyers. It's completely counterintuitive, but they have to understand that.
All right, so when we talk about what you can do, how do you help people identify the process that you just described and give them something that they can really hold on to?
Well, first you educate them about what panic is, and then you explain to them the process that goes on inside their mind. There's a bunch of what-if catastrophic images that go in their mind. See, there are two characteristics involved with having phobias, a fear of flying. Number one is you tend to be very vivid in your mental imagery, and it projects out into the future, and it's catastrophic. So a person who gets on a plane doesn't think to themselves, hey, maybe I'll sit next to the greatest person in the world, develop a relationship for the rest of my life, or find $1 million in unmarked bills. They think, what if the engine falls off? What if the wing falls off? What if I freak out?
Some people suggest that if you have a fear of flying, that you should take some kind of a mild relaxer. Some people say that you should have a drink on board. What are the realities of that? Are those myths or facts?
Those are somewhat helpful. Some people who are really into control, people who are afraid of flying, often place a premium on control. And for them, the loss of control in their mind actually increases the anxiety. Some people like to be medicated. The real problem is that people think, well, if 1 or 2 drinks makes me feel a little better, and 3 or 4 or 5 is going to make me feel that much better, and it's just not true.
When someone has an anxiety, you talk about an anticipatory
anxiety is a big bugaboo for flying, because in practical terms, it's hard to fly frequently. We get over fears by doing things over and over again. In practical terms, most people don't have the opportunity to fly real frequently. But if you can sit in the comfort of your living room and imagine yourself taking a flight next week and think to yourself, well, what if I start to freak out? What if I can't handle it? What if I embarrass myself? And you actually get physiological reactions to that imagery in the comfort of your living room. And then you think to yourself, well, if I'm so terrified in the comfort of my living room thinking about flying, then by the time I get on the plane, I'll never make it. Cancel the flight.
One last thing in the few seconds we have left, who all of those would-be patients out there who might really like to be able to sit down with you and talk through and work through their anxiety. What would you say to them, concrete, as a starting step?
Well, you have to recognize the fact that you have a real fear. It's real, it's treatable, and there are specialists throughout the country who can help you cope with this fear. There's a very high success rate for people who take this seriously and try to overcome it.
Martin Seif, psychologist, thank you very much for talking about an issue that a lot of people probably don't even want to admit they have it, but we do know it's very real.
Thanks.
Appreciate
Love
you being here.
Bye-bye.